Ever watched a sci-fi movie and thought, whoa, when will surgery be that cool? Well, get this, it kind of already is. We're diving deep into minimally invasive and robotic surgery. Think like smaller incisions, faster recoveries, and tech that seems straight out of Star Wars, honestly.
You're not wrong with that Star Wars comparison, actually. It's pretty amazing how minimally invasive surgery, or MIS as it's called, has, totally changed the operating room. We've gone from these huge cuts to like procedures done through tiny little openings using special tools and cameras and all that.
So less cutting, more like some kind of high-tech game of operation then.
Yeah, kinda.
But like, what does that actually mean for the patient, say, for their recovery time?
That's the real difference maker, yeah. Take laparoscopic cholecystectomy, for example. That's removing the gallbladder. It's a pretty common MIS procedure. And instead of a whole week in the hospital, patients often go home, like the very next day.
Wow, that's incredible.
Yeah. Less trauma to the body equals way faster healing and getting back to your life.
Makes sense. Now, we got to talk about the robotic part of this whole thing. Robots in the operating room. Sounds kind of freaky. Like, do they have a mind of their own, making decisions about slicing and stitching?
Haha, that's a pretty common thought, actually. But while the technology is mind-blowing for sure, the surgeon is always the one in control, 100%.
Okay, good to know.
Yeah, imagine, like, sitting at this console, it seriously looks like something from a spaceship, and you're controlling these super delicate instruments.
So no chance of a robot going all Frankenstein in there.
No, no, absolutely not. The surgeon's expertise is still what matters most. The robot is basically an extension of their own skills, just allowing for crazy precision and control.
Gotcha. So no lightsabers making incisions just yet.
Not quite yet, but we are talking about procedures done with robotic arms that have a way bigger range of motion than, like, even the human hand. Plus, the surgeon gets this 3D magnified view of everything, which is especially helpful for super intricate stuff. Think like reattaching nerves or removing tumors in really delicate areas.
Whoa, that's wild.
Yeah.
So robotic surgery isn't just about making things smaller, it's about making things super precise.
Yeah.
Speaking of which, I've heard of the Da Vinci surgical system. Is that like the big name in robotic surgery?
You could say that. Yeah, the Da Vinci is a big deal for sure. It's been used in tons of procedures, like all over the world, but it's not the only one out there.
Right.
There are other systems too, each with their own, strengths and what they're best for.
So it's like choosing the right scalpel, but for robots, huh?
Exactly.
So with all this crazy tech we have now,
Mhm.
are we going to see open surgeries disappear completely? Like, will they be a thing of the past?
I know, right? It's tempting to think so.
Yeah.
MIS and robotic surgery have definitely like revolutionized a lot of procedures, but it's not a one-size-fits-all kind of thing.
Yeah, that makes sense.
Open surgery is still necessary sometimes, especially for really complicated cases or, if something unexpected comes up.
So it's all about using the right tool for the job. But it sounds like no matter how fancy the tech gets, it still comes down to the surgeon and their skill.
100%. The technology is only as good as the person using it. Surgeons go through some intense training to master these systems, and their experience is key in figuring out the best way to approach each patient's, specific needs.
For sure. But let's be real, all this robot stuff, high-tech surgery, it's got to be expensive, right?
Yeah.
What about the cost of all this? Can everyone actually get access to this kind of care?
Yeah, that's a really important point. As amazing as these advancements are, they don't come cheap. Robotic systems are a huge investment, and unfortunately, that cost gets passed on.
Yeah.
So, yeah, it raises questions about who can actually get these treatments and how we can make sure everyone benefits, not just a select few.
Exactly. We don't want a system where some people get the latest and greatest while others are stuck with, like, outdated methods just because of their, financial situation.
Exactly. That's why there are so many discussions happening right now about making this technology more affordable and accessible for all patients. It's a big challenge.
It sounds like it. This is all super interesting stuff. But I can't help but wonder, like, what's next? I mean, are we going to have nanobots doing surgery at, like, a cellular level?
Mm-hmm.
Will surgeons be controlling robots from, like, across the world? It's like trying to imagine, like, what's after smartphones when all you've ever known is a fly phone.
Yeah.
It's tough to even, like, picture what's next.
Totally. But we're already seeing little hints of the future,
Oh, yeah. Like what?
Well, imagine AI right there, assisting surgeons like in the moment, analyzing images and giving insights during, an actual surgery.
Wow.
Or robotic systems that can do more and more complex stuff on their own. But of course, still always with the surgeon overseeing everything.
Okay, now my mind is really blown. But seriously, all these advancements are like crazy exciting, but there are definitely some big questions we got to think about, right?
For sure. As we push the limits of what's possible, we have to be careful about the ethics of it all, too. Like, how do we make sure this technology is used the right way? What about bias, in those AI algorithms that are used in healthcare? Those are issues that, like, researchers, ethicists, and even policymakers are trying to figure out right now.
It's like opening one door and finding a whole hallway of more doors. So for everyone listening who might be like a little overwhelmed with all this info, let's bring it back to the main points. What are the big takeaways from our, deep dive into the world of minimally invasive and robotic surgery?
Well, I think the biggest one is that surgery is becoming less and less invasive, which is amazing for patients. Smaller incisions, you recover faster, there are fewer complications. It's a total game changer.
Yeah, absolutely. And even though robots are becoming more common, we got to remember that it's still skilled surgeons making the decisions. Like, they're the leaders, and the robots are their instruments,
All right.
right?
Exactly. And just like with any powerful tool, you got to use it wisely and ethically. Making sure everyone has access to these advancements is so important so that everyone can benefit from all this progress.
It really has been an eye-opening deep dive, that's for sure. So as we wrap things up here, I'll leave you with this. Next time you hear about some new amazing surgery, don't just think about the tech itself. Think about the human skill behind it, the ethics involved, and what it means for healthcare overall. It's a super fascinating field that's changing so fast, and who knows what kind of incredible advances are coming next.